Good day to all attendees, good morning, and good evening to all four corners of the world. My name is Dr. Osman Osman Elmahi, and it's a pleasure to be here today presenting to you as an invited speaker to the International Conference on Infectious Diseases of 2022. And today I shall be presenting my article to which I've submitted, which is The Fight Against the COVID-19 Pandemic, Vaccination Challenges in Sudan. Before I begin, I'd like to briefly introduce myself once again. My name is Dr. Osman Osman Elmahi. I graduated with the degree of MBBS, Bachelor of Medicine and Surgery, from Ibn Sina University, Faculty of Medicine, in October of 2019 with a 1-1 or first class honors. And during this time, I've also managed to claim a multitude of prizes, and most notable of which being the Community Medicine Prize in 2017-2018. And following this achievement, I have with Medicine Sudan for the term of 2018-2019. And I've also upheld multiple leadership roles further on, including the thought leadership at the Network Towards Unity for Health, and also a research fellowship in global health at the National University of Ireland in Galway. And I now serve as a Foundation Year 1 Doctor at Hull University Hospital's NHS Trust, based in Hull, United Kingdom. So to begin with, regarding the challenges faced in terms of COVID-19 vaccination in Sudan, we'd like to begin by briefly giving the overall picture from the very beginning of the COVID-19 pandemic. The first case of COVID-19 in Sudan was reported in Ahmed Qassim's Children's Hospital in March 13, 2020, and at present, since that date, a total of just over 50,000 cases, 50,003, were reported, of which included 1,835 deaths, culminating in a mortality rate of approximately 3.6 to 3.7%. 72.5% of confirmed cases of COVID-19 occurred in Khartoum state, and the most responsible group for COVID-19 cases was the age group of 20 to 29 years of age throughout the nation of Sudan. 95.3% of any suspicious cases of COVID-19 amongst healthcare workers in Sudan were confirmed to be positive as of October of 2021. And Sudan in itself set the pace for distribution of COVID-19 in third world countries, as it was the first country in Africa and the Middle East to receive the COVID-19 vaccination through the COVID-19 Vaccine Global Access Program, or COVAX program. A multitude of challenges exist within the Sudan's cold chain system in terms of delivering vaccinations, which could drastically affect the distribution of the COVID-19 vaccinations. First and foremost, during the reign of the transitional government in Sudan, economic hardships have further compromised the substandard quality of its immunization supply chain. Sudan is predicted to receive a total of 17 million doses of the COVID-19 vaccination by the end of 2021, with a total of 38 million doses expected to be procured before the achievement of herd immunity. In the eyes of the Directorate of Global Health in Sudan, herd immunity would be defined as reaching the 60% mark of an immunized population, i.e., of 40 million people, this would amount to 24 million people receiving their COVID-19 vaccine doses. Vaccine transportation, in conjunction to the above challenges, is not instated in the expanded program on immunization to immunization supply chain, or EPI-ISC for short, and the government has issued no clear budget for allocation to distribution of the COVID-19 vaccinations. Delays in resource mobilization, in conjunction with delays in procurement of new equipment related to the cold chain, have drastically slowed down the distribution of safe the safe distribution of COVID-19 vaccinations outside the borders of Khartoum State. Regarding the distribution of the COVID-19 vaccination itself in Sudan, there are a few points to mention before we embark onto the phases of distribution, which we'll see shortly. Sudan's initial emphasis was on direct reductions in both morbidity and mortality related to the COVID-19 pandemic, as well as in restoration of the most basic essential services. However, despite these targets, it soon grew to include the vision of the Directorate of Global Health soon expanded to include reduction of the spread of disease and disruption of social and economic functions. And this was accomplished by achieving immunity or immunization of 3% of the population who have received at least one of the 2 doses to complete vaccination, including frontline healthcare workers with direct patient interaction, as well as the elderly who have comorbidities. The first wave of COVID-19 vaccination preceded the goal of 4%, and then followed the prioritization exercise, during which 16% of the population was covered to optimize the gain from the COVAX facility, which then expanded to cover between 20 and 60% of the population using the window of cost sharing. The stages of COVID-19 vaccination distribution have stood thus. Regarding the first stage of the COVID-19 vaccination distribution implied very limited vaccine availability, during which only 4% of the population have received at least their first vaccination dose. The targets of the first phase of distribution included healthcare workers in COVID-19 quarantine centers, in hospitals, in primary healthcare centers and GP surgeries, and in outpatient clinics. Over 500,000 healthcare workers were planned to have received their first dose during the first phase of distribution of the COVID-19 vaccination, together with over 45s who suffer from comorbidities and chronic medical illnesses, as well as residents whereby anticipated high community transmission rates exist. In the second stage, after completion of the first, we implied that the vaccination availability is limited, and not severely limited, as at least 3 to 20% of the population will have at least received their first dose. Stage 2 intends to target over 55s with chronic medical conditions, with higher emphasis for respiratory conditions, including chronic obstructive pulmonary diseases and asthma, as well as previous history of tuberculosis, also including teachers and school staff and essential workers for whom a high risk of exposure to COVID-19 is inevitable. And these would include public service centers, transportation facilities, energy services, including gas, electricity, and joinery, the armed forces, as well as financial and banking services. Stage 2 also intends to include 16 to 45-year-olds who do not have chronic comorbidities and over 16s living in crowded accommodation whereby self-isolation and social distancing may be extremely difficult to maintain. And a variety of such centers exist and would include detention centers and refugee camps. The third stage of the distribution of the COVID-19 vaccination would imply moderate availability following completion of the second stage. And this would imply that at least 21 to 50% of the population will have received their first dose. In this phase, the Directorate of Global Health at the Sudan Federal Ministry of Health in Sudan would intend to target pregnant women, lactating mothers, as well as 16 to 45-year-olds who have not had previous access to the COVID-19 vaccination in previous stages, as well as children aged 5 to 12 and adolescents aged 16 years or above. Following the elaboration of the distribution phases of the COVID-19 vaccination in Sudan, we then move on to describe the elements of political commitment to vaccination phases during these three stages, in particular the third stage. Financing the third phase of COVID-19 vaccinations needs the willingness of the Sudanese government to finance the third phase in the middle of an economic crisis following recent democratic change. To elaborate on this particular point, the government of Sudan has been under severe pressure in order to allocate finances accordingly, as a result of having obtained power from a militant government which has ruled Sudan for the last 3 decades, from 1989 to 2019. Between 2019 and 2022, we undergo a phase of transition with a temporarily elected government, who is, in this case, at this moment in time, under severe pressure in order to adequately address any deficits within the healthcare system in Sudan. Secondly, besides the lack of internal funding and support, Sudan's healthcare system has suffered the consequences of long-standing economic sanctions that lasted for 20 years and ended in 2017. From 1996 to 2017. The Sudanese government would be required during the transition phase to collaborate with more external organizations and build external relations beyond the borders of the Sudan, throughout Africa, the Eastern Mediterranean region, in Europe, and across the globe, in order to fund and assist with improving access to vaccines among Sudanese citizens. To conclude, Sudan faces a variety of challenges in adequately vaccinating the population against the COVID-19 pandemic, and these would range from severe economic hardships which have been endured for the last 3 decades by the people of Sudan, as well as deficits in the cold chain system in Sudan, which would then as a result hinder the safe transport of the vaccine beyond the borders of Khartoum state. Amid a struggling economy, the cold chain system in Sudan remains under-resourced and cannot meet the expected increase in capacity to store additional doses obtained through COVAX, which, as mentioned earlier, is expected to surpass 38 million doses by the time the Director of Global Health in Sudan achieves herd immunity among the Sudanese population, to procure and to mobilize new equipment, which therefore culminates in an extremely slow vaccine distribution beyond the borders of Khartoum state. As such, a call to action for governmental and non-governmental organizations and other non-profits to implement a multilateral approach to address financial and logistical vaccination challenges is therefore urgent. Moreover, it is vital to increase awareness among the public, as well as health professionals, in all sectors of healthcare, from curative medicine to osteopathic medicine to nursing to public health, and even to lab technicians, as well as many more specialties. It is vital among these people to increase awareness, as well as to address the vaccine hesitancy among the Sudanese public. And without all these elements collectively, we cannot achieve the elements of herd immunity, which have been defined by the Directorate of Global Health. As such, I thank you all for your time, and again, it has been an absolute pleasure being able to be invited as a speaker to present to you here at the International Conference on Infectious Diseases.